Hello and welcome. My name is Alan Wylęgała. Last time I reviewed Optos Silverstone, the most expensive fundus camera. This time it's going to be something cheaper, namely DRSplus from iCare. This is the little version of the mighty add-on from iCare that I've already reviewed, but DRSplus also works with the AI software called Illume, and I'm also going to cover this software in this review. So please stay with me and watch the review of DRSplus and Illume. This is the DRSplus, little brother or sister of the add-on. It looks from both sides the same. It has a tablet. From the back side you can see the USB ports and you can cover it all with this cover. You can switch the place where the tablet is positioned, and there is no chin rest in this machine. There's only a headrest, and if you look closely there is the green light, and this is the fixator. It's a tiny, small, but it also blinks, so it's much easier for the patient. To operate the machine, we are going to use tablet, but we're also going to use it for viewing the patient. So just simple information that you need to put, and you can view and very high quality images of the fundus. So this is what you can get. You can get the anterior segment images, you can get the posterior in both color or in infrared. This is how it operates. If you saw my movie about add-on, or you know the add-on, this is the very same software you have. So you can change between the color or the infrared or both, and you can select different fields. I have to say that this is the most comfortable fundus camera I've ever tested. So you just lie your head, and there's no chin rest. It's a very comfortable position, and the machine automatically focuses on your retina and takes an image. Now this is the infrared, and you can save everything as PDF. You can print it, you can save it as a JPEG or any other format that's possible with the machine. DRSplus can also be connected to your computer, and then you can view all these images and save them on your desktop via the website based viewer. You can export them on PDF, and you can also select them based on the date of examination, and you can naturally delete them, and you can create mosaics. So this mosaic has been created from 5 images, automatically done by DRSplus, because it changes the fixation and then focuses on different parts of retina. Although it doesn't have the autofluorescence or fluorescent angiography options, it does have anterior segment imaging, which are astonishingly good. As I mentioned, you can have the true color and also the infrared done. Plus you can also use the filters for that reason. This is the iCare Illume window, and it's in Polish as I am in Poland. So this is the screening tests. Then you have the referrals, so you can actually automatically refer the patient. It's not really configured for my site. And then you have the devices, so you can change and see your devices, and also change the name of your center. These are the dates I would like to see, and these are patient identification, date of the examination, and then you have the information about some disease that was automatically diagnosed by this machine. So if it's on basically green, everything is fine. If it's on red, it means you should refer the patient for further trial. So let's look at this. We have the severe diabetic retinopathy, and we also have the early AMD and severe diabetic retinopathy. Let's look at the scans, and I can imagine that this might be severe. This is the right eye. Yes, we have plenty of hard exudates. We certainly see a lot of microaneurysms and some ear mass, also retinal hemorrhage on the other eye. Whether there is an early AMD, I'm not 100% convinced about this. And again, the other eye. So yes, it possibly is severe diabetic retinopathy. And then you can also see the artificial intelligence report, right? So this is the diabetic retinopathy, severe, no AMD, no glaucoma suspect. Again, severe diabetic retinopathy, early AMD, but it's just, let's say, marginal. And here is how the machine was actually, the algorithm works and how did it calculated the diabetic retinopathy based on the findings that you can see here, the hemorrhages. Naturally, this ETDRS classification is in 4 quadrants. As you can see here, we only have 2 quadrants. So I wonder, like, is it really that close to the ETDRS? We will see. We can export everything in Excel. And here we have a patient who has high likelihood of glaucoma. So let's look at the nerves. And you already see that the nerves are pretty pale. They're also capped. Although I believe the algorithm looks at the reflectance of the RNFL, and by that it can measure GCL and measure the thickness of the nerve layer and determining the suspect of glaucoma. And next we have proliferative diabetic retinopathy. The computer got it 100% right. And here again, this is proliferation. So here the machine got it wrong. This is the proliferative. You can see NVD on the disc, and then there is also neovascularization most likely elsewhere. So just here. Okay, let's look at something easier. This is the mild diabetic retinopathy, and let's look if it's true. Oh yeah, we see some hemorrhages definitely, and also some, I guess, microaneurysms here. So it's really good when it comes to resolution. As you can see, it's really accurate. Yeah, it is definitely then moderate. On the other side, we don't see any signs of disease. So let's look at the summary. So only mild diabetic retinopathy, no AMD, no glaucoma. Again, everything that you printed this out for the patient. So if you want to have a report like this, you just need to have the examination, and then you click send. It takes some time to generate the report.
A few moments later.
And then we can see the report. Everything's perfect, well, except for the scan quality of the right eye. Left eye is fine, so most likely there's nothing. Here we can exactly see how the RNFL travel through the retina, and I can imagine that the GCL that's measured based on this fundus camera is pretty accurate. The machine can also detect AMD. So here we have a patient who has mild diabetic retinopathy and mild AMD. The patient has diabetes, definitely, and you can see there is some drusen deposits, probably some coalescence drusen, and the left eye also, and you can see a few hemorrhages as well, indicating that the patient might have both diseases. So you see that this algorithm is quite specific, especially for the macular region. Another issue is that this AI technology depends on the quality of images. So if you have low quality, it will not work. So what are the upsides of this fundus camera? It provides you with high quality imaging. It utilizes the true color confocal technology with white LED illumination that produces sharp detailed images and excellent contrast, and also high optical resolution. It can image through media opacities like cataracts, like hazy corneas, like disturbances in the vitreous, because it is a confocal system. It's also very comfortable for the patient, as I mentioned. It doesn't require mydriasis for most cases, and also the illumination is not as bright as many other machines. This machine is fully automatic. So auto alignment, autofocus, auto exposure, it's very simple. Anybody who knows how to use tablet can use this. It's also quick. And then you have multiple options. So you can use true color, you can use red free and blue. But on the other side, you don't have the fundus autofluorescence, you don't have fluorescing angiography. It's also small, and I like small machines because, you know, we have the problem with all the machines that needs to fit into rooms. So that's definitely a plus side. What are the downsides? Well, it's only 45 times 40 degrees field of view. In today's world, this is really a limitation. Especially since multiple OCTs are right now equipped with high quality fundus cameras. So if you just need a fundus camera for the macula, just invest your money and get yourself an OCT with a fundus camera, and you are going to be much happier than without. However, I can imagine that somebody owns Optos, and let's say they have Zeiss Cirrus system, so no fundus camera OCT, and they need something high quality and not something that will ruin them financially to document macula. In that case, DRSplus might be a good option because it's fast, it's comfortable, it's easy to use, and it provides you with super high quality images of the macula. And to compare it to ADON, this is the ADON single shot, and this is the mosaic composed of 5 images. There is no way you can use this without the automatic version. I mean, the automation works seamlessly, but I can imagine that for some patients it's not going to work. Then the problem is that sometimes, like in this case, the mosaics are not going to work, and this is the problem of mosaics. It's much better to have wider field of view than to rely on mosaics, not only time, but also that multiple round spots like toxo scars or here too much laser power, it is going to be misaligned. So who is this machine really for? Who's the target customers? Well, in today's world, I wouldn't say ophthalmologists, right? Devil lies in periphery, at least in retina. If you need that fundus camera, if you want a fundus camera, I would highly suggest getting something that will give you further field of view. It doesn't have to be Opto Silverstone, but there are other options. The ADON is one of them. There are multiple other fundus cameras that deliver further into periphery. The question that I would like to answer, is this machine for ophthalmologists? I don't think so. But I think that for non-ophthalmic doctors and physicians, this is a perfect machine because it's not very expensive. They are not going to use fluorescent angiography. They are not going to use autofluorescence. So I have a few friends who are diabetologists or internal medicine or family medicine, and they bought this fundus camera together with Illume because they don't need to send every patient for a checkup for ophthalmologists. They just need this, Illume, and then they only send patients with specific conditions, which is definitely very fine for their patients, rather than sending every patient just for screening. This is a perfect tool, and I hope more doctors are going to use this and then refer the correct patients, because multiple times you just have loads of diabetic patients who have no diabetic retinopathy, and you feel like you're wasting your time and their time, whereas they can just get a quick photos of the retina and then be referred only those who have some problems. Why do we have it? Well, we have it because we got it from a company that makes drugs for diabetic. And the second thing is it stays in our cataract office. And in cataract, you sometimes have patients who are coming for cataract and they need to have some documentation of the macula. It works fairly nice because it's a confocal system, so you get high quality images despite the cataract. I use Illume from a diabetic clinic that I work closely with, so that the patients don't wait a very long time. If they have PDR and they need rapid laser therapy, I would just expedite them. With Illume, the issue is that this is a highly sensitive machine. I'm not sure about specificity as well. For instance, if you have patients who have vein occlusion, they will be designated as the diabetic retinopathy. But anyway, the idea is to find patients who have retinal conditions and refer them and leave the correct diagnosis to the doctor, to the professional. So there is definitely nothing wrong with high sensitivity, and this machine and this algorithm proves to be highly sensitive, and I think this is the most important part. What are the downsides of Illume? Well, it runs in the most hated system for customers and probably most loved system for the companies. It's a subscription-based pricing. It's also based on the number of patients, so you have like different values for different expected patients that you are going to screen in a month. So that's the problem. But on the other side, you're using their computational power. So in cases of cloud, you need to be ready to pay a monthly fee for using it. The iCare DRSplus and Illume software, they combine the advanced imaging and AI technology that can revolutionize retinal screening. DRSplus excels with these true color confocal imaging that is possible in most cases without dilation, while Illume enhances the efficiency by detecting diabetic retinopathy, AMD, and glaucoma. The downsides are it's a 45-degree system that cannot be upgraded to include fluorescein angiography or autofluorescence. However, if you're looking for a tiny fundus camera just for macula and paracentral regions, this might be a very good choice for you. Thank you very much for watching my review. I hope you've enjoyed. Please subscribe to my channel and goodbye.